Welcome back to Global Visitors Board here on Arise News. How do you build digital infrastructure from scratch? A number of Nigeria's players in the tech segment, well, a number of startups are trying to solve a whole number of problems, and before they even get to solve those problems, well, they've got to build their own infrastructure. And here we're going to be focusing on the healthcare segment in Nigeria. We are happy to be joined by Adeola Ayoola. She's the founder of Famasi Africa, an online platform for delivering healthcare medicines to customers at their doorsteps. CEO and co-founder. Good morning to you, Adeola. You're very welcome. Thanks for joining us.
Thanks. It's great to be here. Good morning.
Fantastic. So, with our eye on tech now, I wanted to ask you about this platform that you've created here in order to make deliveries to people. Can you explain the value chain that you had to put together in order to from your platform to the end user?
Oh yeah, sure, definitely. So my company is Famasi Africa, and what we do is we have built like an operating system that allows businesses and people, individuals, to connect to pharmacies. When we started, we wanted to build an online pharmacy that would just let people that have to take drugs on a recurring basis get access to their medications. So we first had to go into the market, understand the pain points. Even though I am a pharmacist myself, I have seen these problems. But we went around Southwest Nigeria talking to pharmacies, trying to understand their pain points and what they're trying to solve. Then we went ahead to first aggregate these pharmacies. We set out a wait list, and people wanted to get medications across 6 states. But to do this effectively, that means we had to build like pharmacies in all of these different states. And we didn't want to have to go through that. So we aggregated existing pharmacies, and then we started to work with them. But what happened was we had to start calling them manually to find out what medications they had, what the cost of the medication was, if it was not available, maybe possible alternatives to getting these medications. But as our numbers grew up to like 15 states, it now became very chaotic to continue to do that. So instead, we had to now build an infrastructure that would make it very easy from the providers to be able to get medications. So what it looks like today is when the provider signs up on their dashboard, they're able to request for the medication, and then from our own system, we can look at the medications, look at the pharmacies that have it, the price and alternatives. Then they pay, and then the medications get delivered to the customers. And on the customer side, they can now automate their refills. Save a lot of time, really, so they don't have to always look for the medications and get it delivered to them every month.
Fantastic. Thanks for that. So, that sounds really in depth. What about what's the, I guess, cost pressures for getting all that off the ground?
Oh, so our technology is in-house. We had to hire our own team, get this done.
So made in Nigeria, by Nigerians,
for Nigeria. Yeah, that's what it is.
Okay, yeah, carry on. So it's all in-house.
Oh yeah, so it's all in-house. We work with people, specifically people that have also experienced these problems that we're trying to solve. So they understand how they would have wanted the solution for themselves, and then they're able to build it because they also have like the technical expertise to get it done. So
this is, in summary, it's almost like a digital bridge with that connects everybody from the individual that needs the drugs or medicines to the provider, and you being sort of like the middleman.
Oh yeah, from the businesses that also need to provide to their customers.
Oh, okay.
So it's not just the individuals.
Sorry, so I'm thinking only of individuals. So also, okay, so it's a two-way thing then.
Oh yes, so these businesses already have individuals that they need to get medications to.
Right.
We connect them to the pharmacists. So we're like that bridge that makes it easy for them to get access.
Okay, now, would your life have been made easier if this infrastructure already existed?
Yeah, definitely.
Okay, so who would provide that? Would it be another player before you, or on the government side? How in a utopia, how would this have worked out if things were perfect? You would just, how would it have worked out?
Well, in many different ways. It probably could have been another player partnering with the government, so like a private-public partnership, making it easy to build that infrastructure so that every other person coming into the system can layer on to be able to access pharmacies and access other healthcare services.
Okay, brilliant. So now you've done that. Yeah. So what if someone else was to come into the space now, can they leverage on the network you already have?
Oh yeah, we've built it so that people don't have to start to build it from scratch. And I met a friend who was trying to build an online pharmacy a few years ago, but they also encountered the same problems, and they had to just pack up because it wasn't working. They had to do the manual thing that we started with initially, and they just could not scale it. That just
sounds so exhausting to call, hey, do you have this? Hey, do you have this? Instead, right, to do it manually.
Yes, and if you want to get a medication, sometimes you have to go to 8 pharmacies to get the medication. A pharmacy probably has 1, and they don't have the rest 4, and then you just continue to look for like that. It was...
Okay, so by the way, is the as far as the digital structure is inventory built in? So if you run out of a particular item, was that recorded or they would know?
Oh yes, they would know. So it's an inventory point of sale system, and it is embedded into POS terminal. So it's very easy and simple for them to use. And then it also now notifies them about their inventory levels, their stock levels. If they need to reorder, they can upload all of that inventory on there and make their sale.
Could you charge money to other players that come in to want to use your own network, or let them use it for free?
I mean, down the line.
Yeah.
Down the line, but the priority is right now is to make it simpler for people to access medications and access care.
Okay, so if someone is coming in and they don't know that Famasi has built this infrastructure already and decide to build their own, what happens when you've got different players? Wouldn't it be fragmented if everyone's building their own infrastructure to do this?
Yeah, I mean, so that's how healthcare is currently built. It's very fragmented. Existing players work in silos, and then they don't even interact with each other. Before we were able to build this, one of the first things we had to do was standardize the schema. So when you want to get medications, the way it works in pharmacies is paracetamol is probably paracetamol 500 milligrams, and it's PCM 500 milligrams elsewhere. But they are still the same medication. So first we had to standardize this inventory and create like a schema so that across board it is the exact same thing. And then anyone that needs to plug into that system just needs to go into the system that we have built and access their medications without having to do all of that groundwork again.
And healthcare, we could talk about healthcare for the rest of the day, right? Not just the rest of this show. Does that mean there is room for growth with the space itself and all the other developments? Even on the other side, I know you're doing pharmacies, but like hospitals, the issue with having to get your records and they're so manual and so forth. So what are the growth prospects for tech and I guess for healthcare in Nigeria?
Yeah, a lot. It really simplifies the entire system. If another digital innovation is coming today, then because Famasi has built this, they don't have to start. They just have to focus on how to grow from where we have built into better. And thinking of hospitals too, typically when you go to hospitals today, people don't even really like going to hospitals because there's this really long queue. They have to wait and pray that they find their records that they have kept. But with this, digitizing everything makes it very easy to access the records. And then you can manage your queues, the wait time. The entire system is not just overwhelmed trying to manage people, but focused on actually delivering the care that they are set up to build. So it just opens up the system and makes it very easy for scale and growth.
Fantastic. You said you're in a number of states, yeah? So one always assumes just Lagos and Abuja. What's the experience like in other states?
Oh yeah, great. I mean, Lagos is obviously the very bubbling one that people are very easy to take up this. But you find that even in other states, people have these same problems. They want to access medications. So we're currently in 20 states in Nigeria, and we're currently working with the pharmacies in these states too. And it's just the same problem, just maybe at a lesser scale in some of the states. And there are peculiarities to the conditions that we have to manage in some different states.
Yeah. And if you max out and you're in all 36 states, would you then look at expanding into other countries?
Oh yeah, I mean, Famasi Africa, from Nigeria to the world. But eventually, beyond Africa, we're really looking at emerging markets because, I mean, 50% of the world's population does not have access to healthcare. But in emerging markets, pharmacies are the first point of access. So that means beyond Africa and in all other emerging markets, people need to connect to pharmacies, and that's what we're doing.
Can you build on this? And another issue is insurance. And again, you're a pharmacy. I know that's your lane. But can you see this being expanded to include other? We had, like, for example, the CEO of PenUp yesterday, and for their micro pensions, they are looking at providing insurance to all players in the micro pension space. That is SMEs, micro, small, medium enterprises. So if a PenUp wants to partner with a pharmacy and say, hey, listen, we're trying to get health insurance to all these players. Can your infrastructure beyond delivering medicines, can it be expanded to getting to all those other services?
Yeah, definitely. I mean, we currently work with a few insurance partners.
Well, all right then.
So it can be plugged into it and make it easy.
I do have to quickly ask you about broadband internet. Every time we talk about tech, we have to ask. The penetration is only about 48% right now. As far as networks and connecting and so on, what's the experience like with us having to improve our internet services here?
I mean, so it's just 48% and it's still lesser than, South Africa and Egypt and likes like that. So working in this space, I have seen how this affects operations in pharmacies. sometimes there's no internet connectivity for them to be able to make their sale and be able to give like that inventory transparency. But what we've built is we've made it very easy beyond the urban areas, even in rural areas. We have built our software so that it's compatible with POS devices. And that means even people that don't have that internet connectivity can make sale, manage their inventory, and also get connected to businesses.
Okay, great,
so we've been able to
work your way around that.
Yeah.
That's how it is doing business. You got to work your way around issues. What about regulators? What's the relationship like? And as far as there's also the fear of fake drugs and that being spread around. What's your view on how that's been?
I mean, I like regulatory.
Yeah.
I feel like it's important to have some rules so that everyone can be kept in check and then the population can be healthy. There aren't so many regulatory requirements right now for a lot of online pharmacies, but the talks are ongoing. We're in constant communication with them. A framework has been set. There are some rules that are coming up now for people to comply as they want to run online pharmacies. So we're currently working with them, adhering to them, looking at where this goes and what the regulatory requirements. I mean, at the end of the day, it's just to safeguard the entire population. So,
of course. What does Nigeria's healthcare need more than anything? Is it universal insurance? Is it what do we need right now?
I mean, I think we need three things. I think we need funding. I think we need collaboration, and I think we need technology, the kind of technology that we're building. Out-of-pocket healthcare payment is still about 70 to 90%, and insurance penetration is like 5%. So we need more funding in that regards to make it very easy for people to access medications, be able to afford these medications, and not have to pick between eating and getting their medications just to stay healthy. But we also need collaboration, private-private collaboration, private-public collaboration, just to ensure that these systems that we're building, they work and they are stronger, and then people can easily access them from wherever they are. But also technology. If we're going to scale healthcare, then an infrastructure play is also very important. So how do we make all of this manual work, how do we make it digital so that it's simpler, it's less chaotic, people can now manage all of these things and are not overwhelmed. So
great stuff. I have to ask you about the present realities. Do you see you just reminded me now with saying people don't have to make a choice between whether to eat or get healthcare. Fuel subsidies have been removed, cost of living is going up. Do you see that putting pressure on people's ability to be able to take care of themselves if things are more expensive and they now have to make those choices now?
Oh yes, definitely. And we're already seeing it today. We have customers that, people that have chronic illnesses have to get medications at least 180,000 naira in a month.
Wow.
Now with fuel subsidy, increasing fuel prices and all of these things, then it becomes even more expensive to get medications across to them. And then they now have to start wondering, do I move to alternative means or do I just continue to take these medications? So it's affecting people a lot, but I mean, we constantly try to ensure that we make it very affordable for them. One of the things that we've done at Famasi is for people that have to take these medications for a long time, we work with our partners to ensure that they have the medications in stock and the prices are like fixed for maybe like an entire duration that they have subscribed for, and they continue to get their medications from those partners easily. Just to
that is very altruistic, and it's really, but won't that impact your profit margins if you're fixing prices for a period of time?
Priority is to make it simpler for everyone, really.
Well, bless your heart. Bless your heart. We mentioned real quickly, sorry, and another thing that clicked, when you mentioned funding, as a female-led SME, what was it like for you getting funding to start your business? Was it family and friends, or you got a loan, or what was that like for you?
Initially, when we started, we had to bootstrap. So myself and my co-founder, we had like another job, and then we were putting in our salary from the other job into this business to just continue to make it work. But I mean, after about 6 months, we were able to start to speak with people that were interested and raise money. But I think the most interesting thing was when we started, customers that experienced the service loved it so much that they wanted to invest. Okay. So part of our first fundraising was our early customers. They were happy to invest, and a few angel investors that also liked what we're building.
So what's the space now? From your okay, you see, this is such a great conversation. I'm going to ask more questions, but we're out of time. Adeola Ayoola, you're doing great work. Co-founder, CEO, founder, help me out.
Co-founder and CEO.
Boom, of Famasi Africa in the healthcare space. Thank you so much. Really appreciate your time.